All right, y'all. Welcome back. Today we're talking about paramedic school. So, um, paramedic programs, they vary in length and, shall we say, modality. I have seen programs that take as little as 8 months, 8 to 9 months. Those are accelerated programs that I've seen. Most of them usually last about 1 year. I've also known programs that can take up to 18 months to 2 years. Those tend to be more of degree programs. Um, the 8 month up to a year, those are generally going to be like your certification only courses. And then every once in a while, you will find a place that offers basically it's an associate's degree in paramedic science. And those generally take up to 2 years because in addition to all of your paramedic coursework, you take you'll take other classes that will allow you to be conferred an associate's degree. Now, which one of these programs should you go through? I do not recommend accelerated programs. Anything less than a year, I'm going to be honest with you, I don't think is a great option because I do not think there is enough time I don't think you have enough quality time to teach everything unless the only caveat I might give to that is like if it's something that you have the ability to do damn near full time, you might be able to get enough hours in and have enough time to get enough reps in, both in the classroom as well as your various clinical sites to make sure that you really have a good foundation. But personally, I would stay away from those. The program that I went through was 1 year long, and it was a certification program. It was run through the local 911 EMS service where I live. And so basically that's where you did all of your ambulance ride time. So talking about the actual coursework of it. In EMT school, we kind of talked about how there are some different blocks of training, whether it's talking about medical, more medical emergencies versus traumatic injuries. You hit on special populations a little. But again, that's in a 4-month course. This is an entire year. So the classroom work is much more extensive. It is, the expectations are much higher. And the program that I was in, but I do think this does carry over to the vast majority of them, all of your coursework and the tests that you take after each class, you have to pass them with a certain percentage. It's not enough just to get through them. There is a certain cutoff point that you cannot be below. The thinking generally is that if you are not able to pass each of these sections with a score that's above whatever that benchmark is, there's a chance that you're going to have a very, very difficult time with the National Registry, the written part of it. So let's talk more about the classroom portion of it. So the first thing that you're going to end up doing, at least what I did, you're going to do anatomy and physiology. There's some things that it just kind of helps it lays a good foundation and for you, talking about all the different systems, and it gives you it just gives you a foundation to kind of build off of. The next thing that we did was we talked about airway and airway management. So you're looking at anatomy and physiology, looking at your airway, but this is where you talk about things like intubation. You talk about using supraglottic airways. You talk about airway diseases and how they affect, about how they can affect. You talk about, a little bit about trauma and what happens if you have a traumatic airway and how you deal with that. The next thing that we did was pulmonology. So everything regarding the lungs. You're talking about obstructive airway diseases. That's actually the vast majority of what you spend your time on because, to be frank, if you work on a paramedic service, that's what you're going to end up with a lot of on the medical side as far as pulmonology. You're going to get asthma and COPDers. Every once in a while, you might get a really bad case of croup, which is somewhat pulmonology, but it's also more airway. But so this is where you learn kind of all of the different nuances of dealing with people with various breathing problems. Next block is cardiology. This is kind of a rough one for a lot of people because there's a lot of medical minutia that you have to get into. So this is where we talk about things like EKGs. You will learn how to do a 12 lead. You will learn how to read 12 leads. You will talk about different heart rhythms. You will talk about cardiac arrests. You'll talk about various meds that you give during cardiac arrest and for other cardiac diseases as are allowed by the protocols of your program. This is also where you're going to start going through and learning the various American Heart Association sequences for different types of cardiac arrest patients. The next block that we did was OB and PEDS. This is pretty common that both of these are put together because, to be frank, the vast majority of, if you work 911 or interfacility transport, the vast majority of your patients are going to be adults, physiologically and age-wise. But there are some things that you do have to know. There's things that make pediatrics a very specific and different population to take care of. There are significant vital sign differences. You will talk through kind of looking at, it's like, how do kids present in various medical and traumatic emergencies and just how they differ, because they do not behave like adults when they're injured or hurt, not from a metabolic standpoint and a whole bunch of other things. That's one of the things that you'll cover there. And then you do your OB thing. You will learn about different obstetric emergencies. You will learn how to deliver a baby in the field. You will learn if your protocols allow, and I did work for a service sometime. I had a protocol for this for things like perimortem C-section. So God forbid you get a mom who dies in a car wreck, she's pregnant, you do one round of ACLS, and if not, you've got a protocol to try to get the baby out. That's something you're going to learn and talk about. After that, we went through our medical emergencies block, which is basically everything that we haven't covered so far. So you're talking about basically anything that's not pulmonology or cardiology. For the program that I went through, it was a lot of diabetes and dialysis. So it's like, is your pancreas failing? Are your kidneys failing? All right, next block, trauma. One of everyone's favorites when they go through school. So you start talking about, it's like, okay, what happens in trauma? You talk about penetrating trauma versus blunt trauma. How does the body react? What are the current best practices for trauma? This is actually something that, I went through medic school in 2015. Now I would dare to bet there's probably some things that have changed, because unfortunately we've had a 20-year long window to observe while the military of most of the Western world has been in the Middle East fighting the GWAT. And military medicine is where a lot of trauma advancements come out of, and then eventually they make their way over to the civilian side. So you're going to talk about any sort of new practices and guidelines for this. You'll learn about tourniquets. You'll learn about basically stopping the bleeding. If you're lucky enough, you might even get to go through a TCCC class, Technical Combat Casualty Care, which if you get the chance, do it. I don't care if you're a civilian medic. It's a really good resource, and it's just a good bunch of skills to have in the back of your head so that if you need it, you can use them. You'll learn how to do hands-on trauma assessments, which is something that unfortunately I think gets missed a lot in school. I know it was missed in nursing school as well, which is kind of frustrating. So that's trauma. The next thing you'll do, or should I say that we did, is you talk about hazmat, and you'll talk about environmental emergencies. So things like hypothermia, hyperthermia. And then anything related to any CBRN of, catastrophes and disasters, terrorist attacks, things like that. This is where it's like, if you think most people in EMS are a little messed up, wait till you find out the people who do hazmat for a living, and especially when they start coming up with scenarios for you to do. It's a lot of fun. It's scary if you think about it, but it's fun to kind of talk through some of these scenarios and figure out what you would do when you're trying to do multiple steps of problem solving, both on a logistics and a medical point of view. The last thing that we did in our program, we went over more operations. So you talk about you will learn about the incident command system. If you haven't already gotten your NIMS done, you'll have to do them now. Although I imagine most of you, if you've gone through an EMT program, you'll have to do that. You talk about mass casualty incidents. You're going to learn things like start triage. You will talk about how do you know which hospital to take the patients to. You'll talk about charting. You'll talk about giving reports both over the radio and the hospital. So just kind of trying to wrap up the rest of the all the operation sides of it, and trying to put this together with all of the medical knowledge that you just learned. It's like, okay, now how do we practically implement this? So that's all the classroom stuff. During this program, you're going to have clinicals. For me, we had them in 3 different places. We did the ER, the OR, and on the ambulance. Now, I'm going to talk more about clinicals. I'm actually got a whole separate video that I'm going to talk specifically about those, so stand by for that. Okay, but talking about just kind of the program as a whole. Again, as I talked about with the classroom stuff, you have to pass your test with a certain percentage for the classroom side of the house. Your clinicals are graded by your preceptor. So, I mean, honestly, if you're trying to get to this point in EMS, like, I would really hope that you care enough to understand that this does matter, but it does matter a lot. The final part of your clinical experience is where, in my program, they were called ALS Team Leads. I would imagine that most programs have something similarly named, if not that as well. Basically, by the end of the last couple of months of your program, it's you. You are running the show, and you need to get to the point to where you are acting, talking, moving, and performing as a whole like you are a medic, like you are the medic on that truck. You shouldn't even need your preceptor by that point. And when you get to that point, you really need to treat it like it's your job, because at that point it is. Your job is to do well in school, to get through this program, and to make sure that you are in a good position to pass the registry when you're done, but also when you get a job, start working and to be effective. So here's kind of the final word that I'll leave you with just about paramedic school as a whole. You're going to get out of it what you put into it. As much as being a paramedic, it can be a great level to get to. It can also help kind of push you into other further medical education in a variety of different settings. But what I would really encourage all of you to think about is that you really do need to treat it not only like it's your job, but really try to start going through the mindset of understanding what it is that you're trying to do. You are trying to become the highest level of pre-hospital provider that there is. Like, out there, if you get into trouble, if you get sick in a car accident, stabbed, shot, God forbid, like, paramedics are the ones who are rolling up to you. So if that's the role you're trying to step into, I would encourage you as much as possible, you need to approach this with that level of seriousness in mind. as you're going through school, you can just try to survive. And if you do that, like, you probably will make it through the program. Or rather than just trying, it's like, oh, okay, I'll just get through, I'll just check the boxes of what I need to do. If you really take what you're doing to heart and say, it's like, actually, you know what? No. It's like each thing, I'm going to try to get as good at that as I possibly can. And I'm just going to try to keep polishing myself all the way through. So by the time you come out on the end, you are in a position to where, like, you have confidence in your ability, your instructors have confidence in your ability, your preceptors do. And if it's like the program that I was in, basically by the time you got done with your ALS team leads, it was basically an audition for working for that 911 service. Because it's like, okay, we put you through school, let's see what you can do. And if you can perform at a high level by the end of that, because you're paying attention, you're working really hard to try to get good at things that you're maybe weren't so good at. If you're trying to polish your way all the way through, and you come out on the other end, and not only are you really good, but you can show that you give a shit and that you're willing to learn, it's going to make it much easier to hire you. So that's kind of a very broad and overview of what paramedic school looks like. Stay tuned. I got a video coming where we're going to talk exclusively about paramedic clinicals and just kind of looking at the different places where you will learn and just kind of some tips, tricks, and some advice about that. Thanks for hanging around. If you got a question, throw it down below. Appreciate you guys being here. See you on the next one.